Good evening, everyone. It's Derek Gelderman. Welcome to another Wednesday night webinar, and it's calming techniques for the consult room or the consultation room. So, Elaine, it's over to you, and thank you.
The idea is that in order to work successfully, you need to be able to tune into becoming adaptable in how you perform your work and to be able to relax. Part of relaxing is getting the environment right so that you can work with it and preempting problems that could be there. So in Bihar, we actually had no electricity a lot of the time, so our operating lamp would go out, so we had head things here, and we also had to discover some way of cauterizing blood vessels, so we had an open flame and we put our artery forceps into the tip of the flame to make them hot so we could cauterize the tissues because it was very hot. The animal skin bleeders were a bit of a problem. So that's what this lecture is about, how to be able to become adaptable and how to get the animal to be calm so that you can do what you need to do. It's important to know that most things are missed by not looking rather than by not knowing. You do need to get some of that knowledge to have the know-how, and that's where I think these webinars are going to be great for you. You can go back and refresh your dentistry, you can go back and refresh your anesthetics, and etc. But it is a new skill. Massage and being calm is something that is not taught in vet school, so it's a new skill. But it is also preemptive analgesia. If you can get that animal calm, the adrenaline's not going to build up, the cortisol is not going to be built up, and you'll be able to have your drugs work better. And when you've got a calm animal, you'll be able to look inside the mouth and you'll be able to see things like this little melanoma that you would have otherwise missed. And the back teeth in this area, for instance, this animal's anesthetized, but this animal had been to multiple vets and had chronic sinusitis. And this was missed, I'd say. You can see the gingiva is actually quite healthy here. So it would be possible for people to look at this fractured premolar 4, maxillary premolar 4, and think that it's not a problem. However, if you've got the sinusitis, if you pull the lip back here, and that could be a problem if the animal won't let you, which is why we're talking about calming techniques, then you would have to be suspicious. And when you've got the ability of this explorer tip to get into the hole that is the pulp, then you know that this is going to be draining into the nose, and it is a problem, and you need to get them in. That was the other side of this particular mouth. And the other side, the gums looked perfectly healed and healthy, but there were in fact 3 retained roots. So that animal needed to go on to surgery. And that's another reason that you have to look at some of these mouths. In those little tiny puppies that won't take their pills and won't let you look and throw their heads around, it's often because they're sore. And this is a case of retained deciduous or persistent deciduous baby teeth. Remember, this is a rehash. 2 teeth cannot occupy the same space at the same time, and it's sore. This puppy will not let you look inside the mouth because the lower canine tooth the hole into the palate. So there are 3 aspects to calm in the consult room, and the very first one is you, the vet, your attitude, your skills, your environment, and the team that you pull around you. The other aspect, of course, is the owner of the dog and cat that brings the patient in. So you can have a very calm owner and a very calm patient, and Bob's your uncle. It's really easy. But we're going to talk about skills that we can use so that the owner and the patient can actually be more malleable. So when you add things like massage, essential oils, aromatherapy, you can actually increase these ability for the patient to be calm. And as Wayne Gretzky said, you miss 100% of the shots that you don't take. So if you don't look inside, you're missing the opportunity to do good dentistry. And you're also missing, if you're not aware of the tight muscles in the triceps and in the neck, you're missing the possibility of doing some remedial massage and some physio for that animal so that it's not lame and not in pain. You're also missing the opportunity to diagnose using x-rays, etc., to see their spondyloses and the spinal arthritis that's going on, etc. So you do need to have a calm animal so that you can look. Massage is a new thing to the veterinary world, and there are in fact massage colleges around that are teaching animal massage. And people do come into my practice asking to have their pets have a massage, but we also recommend acupuncture and acupressure and some of the Chinese herbs that we use, which treat arthritis and helps the animal be a lot more comfortable.